How has your or your child's face grown? And how does this affect you? Most people assume that the way your face grows is genetic. That image on your passport, the face that looks back to you from any mirror, it's you. And we're very resistant to feeling that this isn't set, that it changes, and that things in your environment can affect it, or that your face hasn't grown perfectly as it should. Now, we know you can gain significant changes in physical form. Here's an image from Weight Watchers, but I've seen physical changes that far exceed this with bodybuilders, particularly people who are having a big change over their growth phase. The question, obviously, is can you change facial form in the same way? And of course, we know you can. Look at anyone who's had a stroke, and there will be a predictable and quite large change in facial form. One side seems to melt down when the muscles change their action. The problem is not that we can change physical form, it's just difficult to do it correctly. In some ways, we have become creatures of habit. Now, I'm an orthodontist, so I come to this area from an orthodontic perspective. And in principle, why are teeth crooked? It was the big gap in my training. And to be honest, the orthodontic profession openly admits that they don't know why teeth are crooked. They can attribute a cause in about 5% of the population. And those are usually the syndromes, the traumas, the really obvious ones. It's not the average person. For your average person that goes to an orthodontist, they don't know what causes the problem. Now, the hard scientific evidence, well, interestingly, the quality papers in respected peer-reviewed journals seem to all strongly suggest that this is a disease of the environment. It's acquired disease. None of our ancestors had crooked teeth. None of the other 5,400 species of mammals have crooked teeth, except possibly a few domesticated cats and dogs, which is what we would expect. And it's only through understanding the cause of a problem that we're ever going to be able to properly treat it, because medicine is about treating the causes of the problem. Now, one of the groups I've always found interesting is the Inuit population in Canada. At a stroke of a pen, the Canadian Inuits were made Canadian citizens, and many of the groups emigrated en masse into social housing and receiving welfare payments, accepting a modern diet. And here is a group that are genetically similar. They've not changed. And yet within 2, possibly even 1 generation, they've gained the same level of crooked teeth that you see in the general Canadian population. And there's no difference genetically. You assume the same environment, and the same thing seems to occur. When you talk to archaeologists or anthropologists, you'll find that these professions see crooked teeth as a sign of civilization. However, the orthodontic profession is treating malocclusion as if it was almost entirely genetic. We use appliances like this, fixed appliances, to artificially make the teeth straight, frequently with extractions and sometimes even surgery. And when we mean extractions, we're not talking about wisdom teeth. It's almost accepted that wisdom teeth are some form of genetic aberration, that like an appendix, we've grown out of the need, so they're going. There's actually no scientific evidence for this. And many people lose not only a tooth for orthodontic therapy, but don't have their wisdom teeth as well. So that's down 8 teeth. Now, that amazes me. All my fingers fit on my hands. My legs are the same length. There must be something very wrong if people are missing space for 8 teeth in their mouth, or if they need a surgical correction, where only a few thousand years ago no surgical corrections were necessary. It also concerns me that at the end of therapy, people are required to wear retainers indefinitely, forever, the rest of their life. Surely something must be very wrong with the treatment if it's unable to maintain a permanent correction. And the whole concept of holding teeth out of their balance zone permanently really worries me. Worries me that will affect the actual life of the teeth. So what has gone wrong? Well, the 3 main areas which we feel have changed significantly would be the diet. We've gone from predominantly a hard, tough, rough diet. People needed to consume a huge amount of food. They were working out more, they were using more energy. And we've moved to a very soft, very calorie-rich food, just at the moment as we use less energy. It's clear from the wear on teeth that we're now exerting considerably less masticatory effort. Use these or you will lose. It's a case of use it or lose it. If you have strong muscles, you tend to have a square face. Also, there's been a dramatic change in oral posture. The frequency of nasal obstructions has gone up exponentially. And if you have a blocked nose, you are forced to either drop your tongue, separate your lips and open your mouth, or, not breathe. And it seems that what starts as a necessity becomes a habit.